Hi, everyone. Thank you, Kayla, for that beautiful presentation and the photos and your outlook and that poem. Samson's very lucky to have you as his mom. Thank you. So I am here to talk about probably one of our funnest projects that we did last year, which is our New York ALD Outreach Project. So why did we do this? We hit a really important milestone with ALD newborn screening. In December of 2023, ALD newborn screening turned 10 years old, at least here in New York. Yes? So these numbers are a little bit different than what Joe shared yesterday. I think his number was 171, but at the time that we decided to take this on, there were 157 babies that had been diagnosed in the state. And every metabolic center that we visited had to hear this story. I'm sorry, they have to hear it again. But part of the reason why we wanted to do this and go directly to the centers is because our care package program that we do, and those were beautiful pictures, which is a nice segue, thank you, had been running for a few years. And I think at the time that we decided to take this on, we had sent out maybe 65 care packages to 20-something states, and not one had been requested from New York, which was just so strange to us. And we didn't know if it was just a coincidence or if it meant something, or maybe everybody already has the resources we need, but we didn't know what we didn't know. So we wanted to kind of figure out where are these babies and turn this into an educational outreach project and go directly to the centers themselves. We not only wanted to share our resources that we've developed throughout the years, but also see what we can learn from each other, see what these centers were experiencing, what's similar, what's different, and then if we're successful, can we replicate this in other states? So these are the 10. I'm really proud we were able to hit 8 of the 10, so I'll get into that a little bit. Also, throughout my discussion, I'm not really going to name names. I don't think it's relevant. They're all rock stars, and we had, it was just such a great experience everywhere we went. So the timing was really nice because we received a grant to do this from a local bank, the Ponce de Leon Foundation, and we received it just before our last annual conference. And the timing was fortunate because we were able to kind of announce it via letters, and these are people that we would of course be inviting to this conference anyway. So it was a nice way to kick it off, and we did mention this in our standard ALD Alliance updates presentation last year. So we sent letters, we sent emails, really just finding out the right contacts, because obviously doctors move on to other places. And Joe, and I believe it was Sarah also from the state lab, was just super helpful with helping us find the right people. As I said, our goal was to hit all 10. We did the best we could. There was one center that we just couldn't get a hold of, and then the other one, the communication started, and it just, we're still gonna try for those remaining 2. But our goal was to meet with all the disciplines involved in ALD care, so genetics, neurology, endocrinology. There were some other groups that filtered in, which was really great. And we thought naively that we could get this all done in a year. First, just because we're both in New York. Elisa and I are only a borough apart from each other. And also, many of you may not know this, so this is Elisa's labor of love, the foundation, but she has a full-time job as a real estate agent. And I've had the pleasure of kind of buddying up with her in the car on some of those days as she's fielding the phone calls. And real estate in New York City, you're a hustler baby, right? So she's booking those appointments every half hour, and my head's like spinning, trying to keep up. So we thought this would be a no-brainer and very easy. And to hit those 8 centers, it took almost 7 months. And that's because you guys are very, very busy, understandably doing the great work that you're doing, and also just how complicated it is to get all the right people in the room at the same time that are sometimes in different buildings on different campuses. So I'll say it now so that I don't forget. Just thank you so much for making the time for us so that we could accomplish this goal. So I want to make sure I reiterate, because so much of this conference is data heavy, like we're not publishing a paper. This is very unscientific. This is really just like two moms on the road. These are the themes that kind of popped up. And these were the three main things I think that came up in these very open-ended questions, conversations. How the news is being delivered for the first time, that newborn screening diagnosis, what the monitoring looks like and what the care barriers might be, and then of course us getting to share our resources, what they are, do you know about them? So again, very unscientific. But we did ask each center, how many referrals did you get from the newborn? And I just realized for our Zoom audience and new families, I should explain even what the Metabolic Center is. So the newborn screening happens, that blood spot card gets sent to your state lab, and then the report, I'm not going to call it a diagnosis because it's not always a diagnosis, then goes to one of your state metabolic centers, and then in most cases they're the ones to first reach out to the family, although not always, and I'll talk about that later. So we asked each center to give an estimate of how many referrals for ALD they've gotten from the newborn screening lab, and then how many they're currently caring for. So, and again, some centers were able to look that number up, some weren't, they were just guesstimations. We wound up at 96. The 157 number I mentioned earlier was males and females. That breakdown of males was 99. So this, again, unscientific number, but it was reassuring. You know, we kind of felt comfortable, like, okay, we kind of have an idea that this isn't failing, right? That most of these families have at least been in touch with this center at some point. And obviously some may have gone out of state for care. And there were still two centers that we never heard from, and that also kind of helped with the picture, and that maybe these two centers have only had one or two babies, and they're overwhelmed with other metabolic diseases that just they have to focus their patient load more on that just because of how the numbers were dealt. So we felt a little bit better after doing this unofficial tally. So how the diagnosis is delivered. At every center, that first phone call always comes from someone in genetics. So it was usually either a geneticist or a nurse practitioner in the genetics department. But there were some cases where the pediatrician was able to contact the family first. And I know this is a huge debate in newborn screening outside of ALD. What's the right way to do it? Should the pediatrician be the first point of contact? Should it be the metabolic center where they've seen this disease more frequently? I feel like every conference this comes up, it's always a 50-50 split, and we really found that also to be the case in meeting with the clinicians at the centers. I meant to make sure that Joe had the mic before we started, so you can correct me if I'm wrong. But from what we were told is that initially when this started, that the center would either mail or possibly fax the results to the pediatrician, and it changed throughout the years where now they're getting a phone call. Is that true? Or do you know?
I believe it's true that they would try to coordinate with the pediatrician and the metabolic center, who would first contact that baby, right. But that typically we're emphasizing that they should maybe help with getting the baby in and to the center, but the pediatrician, if they know the family, would be like the introduction.
Yes, yeah.
Which is, does it always work that way? Probably not, but that's the way we strive.
Right, and it also differs from state to state, I'm sure. The clinicians that were we want the family to hear from us first, appreciated when things were mailed because it gave them that lead time to try to call ahead of time. But it, even listening to the parent presentations today, I understand why there isn't one true answer because it's different. I mean, even listening to Ashley's presentation yesterday, it sounds like maybe you received too much information that led you down a path that you didn't necessarily have to. So it's really interesting. Is there a compromise? My story personally, we received the phone call from the pediatrician, but it was very, this is what popped up, write it down, I know you've never heard of it, and then take this name and phone number, call them right away. And it was the Metabolic Center that I was designated to. And, you know, I'm your acute care, strep throat, whatever, but if this is real and this is what it is, this is your go-to. I personally liked that, but it's going to be different, it seems like, for every center and every family. So I think it's not a black and white, and that it kind of has to be a combination of both. Okay, so we talked a lot about the MRI. I'm not ignoring endocrinology at all. It didn't really come up a lot in our discussions. I think the MRI is just a lot scarier than the blood draw. So like I said, I just want to make sure to state that we're not ignoring it, but a lot of our discussions about what parents have to face was centered around the neuro aspect of this. So it's not a secret, there's really only a handful of doctors in the United States, and even the world, I guess you could say, that are qualified to interpret the scans of pre-symptomatic ALD boys. Those very, very early changes, you need an expert eye looking at that. So only one of the 8 centers that we met with do happen to have an ALD expert on staff to interpret those scans. That's the bad news, but the good news is that at every center we went to, a relationship has been established, and we waited to hear the names from them, and they do. They know who to reach out to, and most of you are in this room, which is good. I just think it's important to say for the parents to ask about this. You know, I remember thinking when I was dealt this diagnosis, like, I'm in New York City, I don't have to worry about this. And the reality is these were conversations I didn't have and that I should have, and you should too. So who is looking at my scans? Do you know who to reach out to if something pops up? Or is it a reflex? Are you reaching out and maybe I don't know who you're reaching out to? Definitely ask these questions, you know, especially as you're getting close to that first MRI. And we also did provide that list of experts regardless when we visited, along with our resources. And then the MRI goggles came up also in our conversation. So for those of you who, this came up in one of the other presentations, but it's really cool, metal magnet-free goggles that go on, and the child can pick a favorite movie or TV show to watch, and makes the scan a lot easier. Also, you can remove sedation from the picture, which is really nice, one less thing to worry about. 3 out of the 8 centers that we met with have this. Others are looking into it. I think this is another great thing that came out of our visits, because a lot of the clinicians were like, yeah, we've talked about this in the past, we really want to, we have to look into the, you know, because again, it's funding. So it's great, you know, we were able to kind of offer insights into that and talk about the centers that were using it. For me personally, this is something I was advocating, still am advocating for at my center, because we don't have it. Funding is the issue. I did some research on my own about 5 years ago, and it was great. I got to team up with my neurologist, and we went to Sloan Kettering to look at the, you know, we did a whole demo. At the time then, it was, I think, $54,000 to purchase. I'm sure it's gone up. But the last time I Googled it, there were also a lot more players and companies, so there may be options. But I think it's just a really great piece of technology that can make this heavy diagnosis a little bit easier. Okay, so we did ask the doctors what they thought the biggest barriers to care were for their families. So lots of layers here. It's perceived. We didn't survey the families themselves, right? We're just asking the doctors. And again, you know, we don't really know. But these were the themes that came up. We didn't really offer these. It was just kind of like what came up in conversation. And so our top 3, number 1 was transportation. So, you know, here in New York City, it's fine. A lot of the families have been telling us how they hopped on the subway and they got to see Times Square and all, you know, all these really cool things, the 9/11 memorial. As we go north, it's very, very different. So the large catchment areas, the lack of public transportation, it can really make all of these appointments needed for this disease obviously very difficult. 3 of the 8 centers stated that they were taking advantage of telehealth, which is great, but obviously not everything can be done on Zoom. So, it helps in some aspects, but the in-person visits really can't be avoided. The second most cited perceived barrier was the fact that ALD is invisible at birth. So just a lot of upsetting anecdotes about parents and guardians saying, well, my child looks fine. Do we really need to do another MRI? And this isn't a problem it's not unique to ALD, but it was kind of sad for us to hear because we would hope 10 years after that, there's more education, but it's still a really, really big issue that we have to overcome. And the term hand-holding also came up a lot in all disciplines, that we're really just so lucky to have such caring doctors in our community that, look out for their patients even across disciplines. And this was a lot easier too in the facilities that had social workers that they could really lean on and have the time to really make those extra phone calls. And there were in 3 of the 8 centers that had some access where they could call the social worker in for things like this. If this interests you, here I am going to call it out because Dr. Regelman, when we were at Montefiore, mentioned that, and really kudos to them because they actually do survey their patients on these perceived barriers, and she cited this resource, NIH survey, Barriers to Care. So if it's something you're looking to implement, I think that's a great template. So then we got to talk about our resources. Every center was familiar with our Parents Guide. That's not surprising because it's been around now for, I think, 5 years ago at the conference, we sort of unveiled that, and that's based off the published monitoring guidelines that already exist. Not everyone knew about our coping with an ALD newborn screening diagnosis. That's fairly new. That was COVID days when we couldn't even be together in conferences like this, so we were spending a lot of time on Zoom, and this just sort of happened naturally. We got all our families together. We did a lot of sessions. Our sessions were guided by Dr. Pierpont at the University of Minnesota, just to make sure we were producing something that looked good and made sense for families. So it was really, really great to know that there were doctors that didn't know about this and now they know about it. It's just another tool that you guys can use when you're meeting with families. Our care package, so we brought the teddy bear, we brought the donut that roared. We talked about our conference and other educational opportunities we have throughout the year. We, of course, shared that our resources are available in Spanish. And then we did ask, when other languages came up, if funding ever permitted, what should we move on to next? And only 2 doctors, but they both had the same answer, and it was Arabic. But that it wasn't a super, super pressing need, but if the funding is there, so for what it's worth. And then just other notables that didn't really fit anywhere else in the presentation, but that we wanted to mention. So cool, when we were at Montefiore, we learned that they have a hospital library. So we got to do a little tour. And it sounds like a really good system where the social worker can kind of go down and look and see what book might help a particular patient. And because we brought extra, we were able to donate a copy in English and a copy in Spanish of The Donut That Roared. So that's the children's book that helps kiddos prepare for their MRIs. Really cool. And we mentioned this to the author. So this is a teen author and his aunt that wrote this. The teen is now, I think, in his sophomore year of college. And they didn't even really know that, some hospitals might have this also. So they're doing some research on their own to see if we could get this book out. And it's just so good to know, too, that it's going to help other kids outside of ALD, Another really cool thing that we didn't expect or plan for, but it was great, is that while we invited who we invited, some of the meetings really grew because residents or fellows just happened to be around, and yeah, I want to learn about ALD, sure, come, we'll feed you. So it was really, really great educational opportunity. And then also really nice tying in after the transition of care conversation. We had some centers that the adult side was just available and wanted to listen in, so some of the meetings grew really big, which is awesome. Another thing I want to mention, and I'm kind of dreading the conversation that I know we're going to have after the presentation, but it happened, so I have to mention it. There is one center that mentioned in delivering the diagnosis that they changed the words a little bit and that they present it to the family that your child is at risk for ALD, not that they have ALD. And I'm still processing it. I think depending on what cap I have on, I feel differently about it. But the reasoning for this was, in most cases, the baby at this point doesn't have any symptoms, don't know how they will present, if at all. So this is how they deliver the diagnosis, and we can talk about that after if we'd like. And then lastly, just the varying collaboration between disciplines at each center. So this is going to vary because of whether or not you have external funding to hold the type of clinic that you'd like. We understand that. How big your patient load is, how far apart endocrinology is from neurology. So sometimes it could even be in different towns. We were really so impressed for the most part about how, like I said, you all work so hard and work together to make sure that we don't miss any of these babies. But there were a few cases where, in looking at the three main players, again, like genetics, neuro, endo, where one care team member wasn't sure who the other person is. And that just concerns us as advocates, because it's not just about, if and when your child is going to transplant that everybody needs to be talking, but even that first MRI, if the child already has adrenal insufficiency, extra dosing might be needed. So we would just ask that, something I learned from this conference already, like when all else fails, like turn to acronyms, like maybe develop some type of process or protocol. We're just making sure there's some kind of routine check-in so that the endocrinologist who knows who the neurologist is and the triangle and so on. But like I said, by and large, that story that Katie told during her presentation about them making sure they had, all their kids under control and were all on schedule, and then the endocrinologist pointed out, what about this one? So many stories like that. So again, just thank you for that collaboration across disciplines, because it makes all the difference to a new family that's trying to wrap their heads around this. So again, thank you. These are just some of the pictures. And then lastly, thank you, and possibly coming to a state near you. So we're still talking about this. To us, these conferences and the in-person attendance is so important, but we do understand the theme across these past 3 days is that funding being cut from the top does trickle down. There were state employees that we would have liked to come this year that couldn't, so it's a little scary, but I think one of the positives about doing something like this is that you can, this was a private grant from a bank, and they wanted their money to stay in New York, understandably, because that's where their branches are. So I think we could get creative and find the funding in each particular state. I don't know what it's necessarily going to look like. I can't tag along with Elisa everywhere. But I think there was value in me attending these meetings as a parent that had been through one of these metabolic centers. So maybe it's going to look like teaming up with other families local to that state. That's how it kind of works in the legislative advocacy space also. They want to hear from their constituents. So we're going to figure it out. But I think that there's a lot of value to doing this and us getting there. So thank you. That's it. Any questions? Spot there.
That was great, Miranda. So 2 quick questions. And in terms of the timing of when families are told about the diagnosis from newborn screening, I know there's been over the years of complaints that this happens on a Friday afternoon and families are left on the weekend is sort of, desperate. In Amsterdam, they've actually made a policy, no calls on a Friday for newborn screening. I'm just curious if there are any, thoughts, reactions to that. And this,
I like the word policy.
Yeah.
Sure. It did come up, and I'm trying to remember. Yeah, let's. You want to pass the mic to Elisa?
That did come up as far as not calling families on a Friday, but from what one of the geneticists told us, I think it depends on the state itself because they have to give the results within 24 hours. So if that falls on a Friday, they actually can't wait till Monday. So it's the ruling of wherever they happen to be. Yeah.
Yeah, tough one. And then a second follow-up question is, you have this unique experience to see this over a decade. Have experiences changed as families have found other families who've gone through the same experience of newborn screening? Because I think it was particularly hard for that first generation that, they knew of other families with children or boys with ALD, but they didn't have any peers who had been in this sort of situation of having a newborn and going through this monitoring and I think it's gotten better as there is now a larger community and they have people to lean on and bond with. But I was curious whether that's something you see too.
Yeah, I like to think it's absolutely gotten better. I know it has because a lot of these resources that we're giving out didn't exist. When I first went through it, social media came up a little bit. I think when we were there because that's how primarily these families are finding each other. And I think it could be up for debate, but I also think the social media landscape has gotten a little bit better. And I think it's like the don't Google thing. It's just like you have to acknowledge that it does exist and that you can utilize it, but take it with a grain of salt and listen to your doctor and, yeah.
I think sometimes we don't acknowledge how much families feel separate with the experience of the pre-symptomatic diagnosis.
Yeah.
And that's actually something very distinct. So for what it's worth.
Thank you. Anything else? Yes.
Thank you, Miranda, for an excellent presentation.
Thank you.
And, there are probably a number of cans of worms that I could open, just thinking about what you've presented on. But the thing I wanted to focus on is the need for translations of the resources that the ALD Alliance provides. Very thankful for those resources, but I would actually characterize the need for an Arabic language translation not as pressing, but as dire.
Really?
Yes.
Okay, thank you for that.
We have a large Arabic-speaking population in the Detroit area. There are a variety of challenges that come about when a family does not have access to resources in a language that they understand, that are trustworthy, that are compounded by issues related to donor matches, for instance, issues related to structural racism that come about in that community, refugee populations. I think that is a beyond dire need. I would probably use it more than I would use the English language version.
Thank you so much for sharing that. And this is part of the reason why we have to leave New York. Because it's just one very small piece of the puzzle. So thank you for letting us know. I appreciate that. Anything else? Yeah.
It's not really a question as much as it is discussing about getting the call about the results before a weekend. We got ours on July 3rd, in the evening, like 5 o'clock at night, 5:30. And I think July 4th fell on a Thursday or a Friday of this year, so it was like sitting for 4 days with this news that we had, like, could be Zellweger, could be ALD. So that was rough. And if there can be adjustments or shifts, so we know we can have someone to call the next day, that would be better. And in terms of the at risk for ALD, even as the mother of a quote unquote carrier, I feel like that's dangerous. For me personally, it feels better to say pre-symptomatic or asymptomatic just because you have that awareness all the time. Even though technically I don't have to worry about anything right away like many of the boys' families do, but I just feel like that's an important distinction. So thank you.
I just want to say it's really hard. State laws are going to make this very difficult. And as someone who treats kids who the hours before we start treatment can make a difference between an ICU admission or intellectual disabilities for other conditions on newborn screening, I don't know that you are going to be able to get state laws to change unless you do individually. For ALD, it's okay if you call on Monday. I think that'll be really challenging. I think what's more important is trying to communicate with the metabolic centers that, hey, if this call comes in on a Friday, someone's on call.
Yeah.
And that's what we're on call for as pediatricians, is to answer things like this. And I think of it as it may not be an emergency in the medical sense, but it is when a parent or a family doesn't know what the diagnosis is, because these stories are going down the rabbit hole. So I would advocate for metabolic centers making that extra phone call on Saturday morning if they don't reach a family on Friday night. Yeah.
Okay, well, thank you very much. Thank you.